Dr. Moak. I'd like to talk about the Clear and Brilliant system that we have at Allure. Can you explain how the treatment works and what kind of skin concerns is it best for?
Yeah, great question. So the Clear and Brilliant is made by a company that makes the Fraxel. And Fraxel is I always think of it as Fraxel, this type of Fraxel. And Fraxel has been around since 2004. We bought one of the first systems in the US. And it's changed, different variations. We don't have a first machine. But they went for the Fraxel, and it was this really difficult, complicated procedure. You do it 5 times. But it was a breakthrough technology because it fractionally resurface the skin. Resurfacing the skin means taking the skin off, which really is a big downtime and big risk, versus fractionally doing where we take out pieces of the skin at a time with a laser and very controlled, heal really fast. And that first Fraxel was designed to be done 5 times and you get improvements in your skin. That worked great. Then the company changed the technology, added different wavelengths to it. We evolved how we do now with Fraxel. It's advanced that is unique to our practice, only Allure Medical. And we can get a result that's as good or better than a traditional resurfacing carbon dioxide laser without a month of downtime, but with a more like 4 to 7 days of downtime, without nearly as much pain, without all the risk. So this has been a big breakthrough. Well, then taking it back from there, there's something called Clear and Brilliant that the Fraxel company came out with. And the idea was using a very low energy version of the Fraxel and treating even a smaller portion of the skin at a time, like 5%. And what happened is that they were doing it to try to figure out how to treat people with darker skin types and to treat people with pigment disorders without making the pigment disorder worse, which is always a complexity of treating, say, melasma or hyperpigmentation. And they basically detuned the Fraxel machine to allow for that to happen. That's really kind of the majority of Fraxel happening right now is this Fraxel Clear and Brilliant, and in our practice as well. So the Clear and Brilliant is basically a detuned one. But what happens though is that even though we're only taking out 5% of the skin and leaving, as opposed to the regular Fraxel, which is more like 60%, we're creating a medication delivery system. This is really how the Clear and Brilliant or detuned Fraxel should be thought about. It's designed to make medications enter your skin. In this case, it's medical grade skincare. The most notable ones being vitamin C, a very strong vitamin C, a retinol, maybe some hydroquinone or something similar for melasma. And your skin is very receptive to this stuff right after this procedure and for a little bit of time. So if you're doing skincare and you're not getting the results that you want, redness, brown spots, pigment, this texture, pore size, you can do the Fraxel laser, really just step that up. And we're seeing that a lot of women are doing the Clear and Brilliant 4 times a year, just as a maintenance. And at the end of the year, they always look substantially younger than they did at the beginning of the year. I was looking at a picture that one of our estheticians sent us to a lady that did 6 Clear and Brilliants the last year and a half. And her skin on the Visia, which is a computer-generated skin, tell your skin condition, had gone backwards 7 years. So she looks 7 years younger now than she did a year and a half ago. That's good math. That's good math. As we're getting older, we can look or feel younger or be younger in our organs, and your skin is your biggest organ. So the Clear and Brilliant, I love it for the routine maintenance. If you have a condition like severe wrinkles, acne, scarring, a lot of pigment on your skin, just go to the Fraxel. Deal with a week of downtime. And the downtime is not like, it's a little social downtime. You get this peely that goes on for between day 4 and day 7. But it is tolerable. We numb you up for it. So that's one for treating something that's there. They really want to do some heavy work on your skin. But if it's not that bad, or in this case of this woman who had a lot of sun damage, but it wasn't severe, didn't have a lot of wrinkles, and she's doing other stuff along with it, then you can just do the Clear and Brilliant a few times and get a similar result. But the key is you have to use skincare, medical grade skincare. We don't allow you to do it if you're not using our skincare, because I can't guarantee the results if you're using other stuff. Don't know what it is. And if you're not using skincare at all, you're wasting your money doing this Clear and Brilliant, because it is a medication delivery system. So that's a Clear and Brilliant, and we love it. It's the most common procedure. We have several of those machines, one in every office, and it's the most commonly used device in our company for decades.